Morning, everyone, and thanks so much for joining us as we go forward in discussing aspects of the worst healthcare and economic crisis in our lifetimes. There is so much to talk about, but I want to begin in a few minutes by introducing you to three medical folks who are on the front line of the crisis. And I think all Americans understand how deeply grateful we are to doctors, nurses, and other medical personnel all across this country who are putting their lives on the line, literally, trying to keep us healthy and treat those who are suffering from the pandemic. So we thank all of those doctors, and we're going to be hearing from three medical personnel in a moment. We're going to be hearing from Zinni Cortez, who is the president of the National Nurses United, the largest nurses union in the country. We're going to hear from Dr. Jeff Zilberstein, who is vice chairman with the Department of Medicine at the Division of Critical Care at Southside Hospital of Norwell Health in Bayshore, New York. We're going to hear from Dr. Esty Shambleman, who is the Vice President and Chief Medical Officer of Sinai Hospital at Lifebridge Health in Baltimore, Maryland. We also are going to have some music, which will help us in the transition of the nature of our technology, as we can't go directly to our panel. We're going to take a little bit of a break for music, and then we go there. And we thank very much Alex Ebert, who is a lead singer-songwriter for the band Edward Sharpe and the Magnetic Zeros. And later on, we thank Lissy for the music that they are providing us as well. I just want to say a few words before we introduce our doctors and nurses. And that is, all of you are aware that on Wednesday, the Senate passed the largest stimulus package in the history of this country. The House did the same today. This is a far, far from perfect bill, and I strongly believe that this legislation, which is called the Coronavirus 3 stimulus package, will be followed by another package, a number 4, within the coming weeks or month or so. The reason is that there are many gaps in this bill that must be filled if we're going to take care of the American people. What this bill does, as I think many of you now know, provides substantial sums of money to American workers, and that is, it provides a substantial increase in unemployment compensation. And what it does is expand unemployment to cover people who have not historically been covered by unemployment. Over half of our people are not covered. What this bill says, if you are a worker, you are covered. If you're a gig worker, if you're an Uber driver, if you're working part-time, if you're a waitress, you are now covered. So that bill will provide the most significant increase in coverage that we have ever seen in this country. What it also does is, through a $250 billion allocation, it also, for 4 months, will increase the amount of money that people who are unemployed receive by $600 a week. And that is a significant step forward. What the bill also does is provide, for the first time, direct cash payments to working people and their kids. And that is, under this bill, most Americans will receive a one-time cash payment of up to $1,200, up to $2,400 for a married couple, and up to $500 for each child. Somehow or another, should not have been the case. These are only kids 16 or under. Hope to rectify that in the future, but that is the case. Furthermore, this legislation will provide substantial help for small business. We're talking about $350 billion provided in loans to small businesses. Those are loans that could be forgiven if these businesses do not lay off workers or expand employment after the crisis is over. So the goal here is to keep people in small businesses on the payroll. This bill also provides over $150 billion to states and to cities, many of whom are cash strapped right now because their tax revenue has significantly declined. This bill provides over $100 billion to reimburse hospitals and medical providers for lost revenue related to coronavirus. I think we'll discuss tonight how many hospitals around the country are being overwhelmed with patients coming in with the virus. Hospitals are losing the normal source of revenue. They are in trouble. We don't want hospitals shutting down right now. Now is not the time for that. And we provide over $100 billion. This bill also provides substantial help for childcare, for affordable housing, to help our veterans, and in many other areas. The goal here, simply stated, is in the midst of the worst economic downturn maybe since the Great Depression. Nobody knows, but we do know that last week 3.3 million people applied for unemployment. There are estimates that by the end of June, unemployment in this country could be as high as 20 or 30%. And the goal right now is for the government to make whole, to protect all of the working families in this country. And the crisis is that we are living in a nation where half our people are living paycheck to paycheck. Those paychecks are now stopping. People are being laid off. We've got to make sure that they get the help they need as quickly as they possibly can. Now, in that regard, one of the things that we are working on is to make certain that the federal bureaucracy works as carefully as it possibly can, as aggressively, as quickly as it possibly can. Under normal circumstances, getting out this much money quickly would be a serious problem. These are not normal circumstances. Far more people are applying for help. Many workers who would administer this program are staying home because of the coronavirus. So what we have got to do, and I've just spoken to the Democratic leadership a few hours ago, we have got to be as aggressive as we can in telling the Trump administration, do everything humanly possible to hire the people that you need, to get the technology up that you need, so that we get this money out to people who are in desperate need of that money right now. Workers, families, small business people, hospitals, cities, towns, they need the money now. Let's get it out as soon as possible. Later on in the show, we'll talk about how we can, where you might be able to go to learn more about how you can apply for the help you need. And one of the crises we have that we want to overcome is that many of the unemployment office telephone lines are not responding because so many people are calling and they're not responding to the calls that are coming in. The websites are crashing, and this is something we've got to work on. But later on in the show, we'll get you some specific information as to how you can apply. Other issue that's on my mind, maybe we'll discuss it with our medical folks, is we have a president who thinks that in a couple of weeks, so by Easter, the country should be back running. People should be going out to work. People should be going to all kinds of functions. I personally think that that is enormously dangerous. We'll get some expert opinion today. I think if we're going to beat this crisis, we need to continue social distancing. We need to do everything that we can to prevent the spread of this disease. But that's something that we will talk about in a moment. But right now, let us take a break. Let's go to the music, and in a few minutes, we'll be back with our medical personnel. And let me very much thank our music, Alex Ebert, who's going to provide music for a few minutes. And now let's get to our panel. We have three panelists, medical professionals who are on the front line in fighting this pandemic. Zinni Cortez is the president of the National Nurses Union, the largest nurses union in the country. Dr. Jeff Zilberstein is vice chairman, Department of Medicine at the Southside Hospital of Northwell Health in Bay Shore, New York. And Dr. Esty Schabelman is the vice president and chief medical officer of Sinai Hospital at LifeBridge Health in Baltimore. All right, let me start off with Dr. Zibelstein, if I might. We are hearing and reading about the fact that medical personnel all across this country are lacking the protective gear that they need to do their jobs and to protect their health. I think health. In Italy, dozens of doctors and nurses have already died. And what we're seeing in this country is doctors not having and nurses not having the masks they need, not having the gloves they need, not having the gowns they need. We're seeing a lack of ventilators. We are seeing other basic equipment not being made available to hospitals right now, who are being, in some cases, overwhelmed with patients. Dr. Zilberstein, what's your sense of that? What's going on from your perspective, and where do we have to go?
Well, thank you for having me on. I've read the reports and I'm equally troubled, and even more so. I think that we have to protect the people on the front lines. If there's no protection for the people on the front lines, we will spread it, and we will spread it to others, and we will get sick. And that's clearly not the best scenario. We've been fortunate at Southside Hospital and Northwell Health that we have all the PPE that we need currently. And Northwell has been kind of ahead of the curve in terms of acquiring these things, which we're very fortunate about. But I've been reading these troubling stories about how many other health systems have been really completely overwhelmed by the need. It's imperative that every health provider get the protection that they need. Otherwise, it's impossible to care for these patients.
So your point is it's not only a question, which of course we must do, protecting the health and lives of medical personnel. But if we do not, if they get sick or worse, how are we going to protect the American people in general?
Absolutely. I mean, I've told my team this as well, because medical professionals generally are selfless. We run in when the fire is on, we run in and we try to save lives. I've told my team we have to be careful, because being selfless is being stupid. Because if we go and expose ourselves, we're exposing others, and then we're also exposing ourselves and our families, and then we'll be out for 2 weeks or longer or get deathly ill. So we have to be careful with all of this, and this all comes down to preparing and getting our medical staff the equipment that they need. That's absolutely essential. And we've been very fortunate at Northwell Health. Our leadership has been above and beyond getting the stuff that we need. But I've been reading these terrible stories of other comrades in arms who have been lacking the things that they need. It's horrifying.
And what we are seeing is hospitals and cities and states being forced to compete with each other for the limited resources they need, which is pretty crazy.
And that's where the federal government can come in, because I mean, you don't want one state outbidding another state, and so that's clearly where we need additional focus.
Okay, let me jump to what we'll do is, if you could stay on, I want to hear from everybody. We'll have a general discussion. We're going to open up for some questions from our viewers. Dr. Esty Schabelman is the Vice President and Chief Medical Officer at Sinai Hospital in Baltimore, Maryland. Doctor, thanks so much for being with us. Can you give us a sense about what's going on in your hospital in terms of how you are responding to the crisis? All right, I'm having a difficult time hearing you, doctor. Are you talking into the microphone there? All right, I'll tell you what, I'm going to go back to you in a moment, but we'll figure out what the problem is. Let me go to Zinni Cortez, who is the president of the National Nurses United Union. Zinni, thanks so much for being with us. What's your sense of what's going on?
Thank you so much, Senator, for having me. A frontline nurse, I am very frustrated and I am very afraid. Not because I am faced with taking care of COVID positive patients, but because I go there unprepared, unprotected. Well, we do have masks that are available, but it's not the right mask that's needed to care for the patients. And we use gowns that are not up to the level of what we need in order to take care of them. And it's really frustrating for all of us because as nurses, we do not have the luxury of picking and choosing which patient to take care of. We take care of everybody. We take care of all the patients, but we need the proper gear, the proper equipment to safely take care of our patients. And like what has been said before, if we get sick, there will be nobody there to take care of our patients. And just a couple days ago, our hospital was threatening to discipline nurses or even to fire nurses if they brought their own gear because the nurses were using, we were using our professional judgment to see what we needed to take care of the patient. And so we were bringing our own N95 masks, and the hospital had threatened to fire those nurses who were bringing their own gear. They were looking to the guidelines, the preventive measures from CDC, and CDC had said a bandana or a scarf is good enough to protect us from the patients. And we know that's not right.
Did CDC really say that?
Yes. And that was, we were hoping that the CDC would be there to protect us, the frontline workers, and yet they failed to do that. And so we are really scared. We are really anxious because, it's like you wouldn't send a fireman to fight a fire with a squirt gun. And why are they doing it to the nurses? But, we will be there for our patients no matter what. But please help us do our jobs safely. We will take care of the patients no matter who they are. But we need the proper gear and the proper equipment, the proper training, and the proper amount of staff to safely take care of our patients.
Cindy, the NNU represents nurses all across the country. So what are you hearing from nurses around the nation?
Nurses around the country has been saying the same thing. We do not have the proper gear. We do not have the training. We do not have the proper amount of staff. And if I may say, a couple of days ago, we were on a global Nurses United conference call. 28 countries, leaders from 28 nations coming together to talk about this. And you should have heard what the nurse from Spain and Italy was saying. And it's really heartbreaking. We are in a trajectory. We have not seen the uptick and the surge, and we are not prepared. The nurses are not prepared. The hospitals are not prepared. What we need as nurses, again, is the proper protective equipment, the right training, proper training, and the proper amount of staff.
Cindy, let me ask you this. Above and beyond the necessity, of course, of making sure that all the nurses and doctors have the protective gear that they need, what about the number of medical personnel available to treat the crisis? Are people working long hours now? Are they becoming exhausted? Do we have the number of doctors and nurses that we need to respond to the epidemic that we're seeing?
Right now, I think we're fine, but again, when we see the surge and the uptick of the patients coming in, it will probably be a problem. We have shortfalls in having unlicensed assistive personnel to help the nurses in the front lines, and I'm hoping that there will be enough of us to be there to safely take care of our patients. And we need the gear. If we do not protect ourselves, we won't be able to protect our patients, and there will be nobody there to care for them.
Senator, I can kind of jump in here. I've been overwhelmed because our ICU has gone up by fourfold, 4 times the number of patients we've normally been having to take care of. the number of calls I've gotten to help with coverage from physicians and physician assistants and nurse practitioners, critical care nurses, the gamut. This has actually been a rallying cry for healthcare to actually put the care into healthcare. I've been overwhelmed and inspired by my colleagues. I think that I've been overwhelmed by the amount of people that have jumped into the fire to help us take care of these patients.
So Jeff, what are you saying that you're hearing from other hospitals and medical facilities who need help right now, professional help?
Yes. So I'm very close in contact with all 23 hospitals within Northwell Health. We have been on the phone twice, 3 times a week. We're texting all the time. We're in communication. We're sharing resources. And so big systems have been able to really leverage that to really assist other hospitals. And so we're doing that really on an hourly basis, kind of allocating resources based on the need at the time.
Do you have a sense, and somebody else, I think we're going to get Dr. Shableman on in a minute, but Eric, Jeff, do you have a sense as to whether or not we actually have enough medical personnel, doctors and nurses and others, to deal with the upsurge in patients coming into hospitals?
I fear for other hospital systems. Our hospital system has been resilient because we're a big hospital system and we work well together, but I fear for that because if you're a small hospital, you have a couple of intensivists. This surge would have been untenable. We've been able to call on other colleagues to help.
Okay. All right, let me bring let's hope the technology has improved. Let's bring Dr. S.D. Shableman into the discussion. Doctor?
Hey, can you hear me?
Much better.
All right.
All right. You're sounding great. All right. How does the world look from your perspective?
So our ICUs are also getting full, and we're starting to notice here in Baltimore that we're a little bit behind our knowledge of how fast this disease is spreading, because it takes us 5 or 7 days to get the test back. Everybody wants testing. Everyone who has any symptoms, cough, runny nose, sore throat, fever, everyone wants to get tested. And we need to be able to test them so we can accurately map where the disease is, so we can accurately, try to cut down on it. And the test is taking 5 to 7 days to come back.
Do you have, by the way, and we'll talk about testing in a moment, do you have the available tests for the people who want them?
So we have available tests for people within our network, but we're doing 500 calls per day on our telemedicine platform. We have 150 drive-through tests per day at LifeBridge, and we have 900 people under surveillance, but it's within our network. We'd like to be able to open that up to the public, but we don't have enough tests to do that. Other hospital systems in the city are doing the same thing. And there are some public ones that are opening up, but again, within 5 to 7 day lag time, that's a lot of time for people to wonder if they have the disease or not.
So are you only at this point able to treat people within your network?
Right now, we're bringing in, we have a pretty extensive network. We have 5 hospitals and multiple outpatient clinics and providers and practices, and if everyone within that we can refer to our telemedicine program.
All right, are you prepared in your location for the possibility of a surge?
We're getting ready. We're opening up an additional 200 beds in our 5 hospital system. We're converting entire wings to isolation rooms. We're buying ventilators and equipment as much as we can get.
All right, we heard from the National Nurses Union, Zinni Cortez, about nurses not having the protective equipment they need. What kind of shape are you guys in that regard?
So we're in extreme conservation mode right now. We have enough for our day-to-day practice, but we can see that it's going to run out in the future, and we're being very, very careful with how we use it. So because of that, we've had to limit visitors, for example. We're not allowing very limited visitors in the hospital. We've sent home essentially everyone that we can send home so that they're not using PPE, the personal protective equipment in the hospital. And so we have to be very, very careful.
So you're worried about running out of masks and gowns and gloves and all that stuff?
I think every hospital in the country is.
Yes.
And what about ventilators? Do you have enough ventilators, do you think?
So at the moment, we're okay, but we're coming up with contingency plans for how to stretch those ventilators. Right now, again, we're all right, but if this turns into Italy or China, we're coming up with contingency plans such as how to split ventilators between patients, how to stretch ventilators that were meant for short-term use or transport use for longer-term use, because people with COVID-19 end up on ventilators for a lengthy amount